This miracle cream will make your skin look 20 years younger overnight, or so says TikTok. So let's talk about it. Is estrogen cream really the miraculous topical solution to all our anti-aging problems? Or another pseudoscience TikTok anti-aging hack? I'm Dr. Stephanie Kappel. I'm a double board certified cosmetic dermatologist, and I'm here to be your source of truth in an industry full of misinformation and clickbait education. I make these videos to provide a free resource of non-sponsored, unbiased, science-based education on what truly works to age in reverse and beautify your skin at all ages. This video is the first part of a two-part series dedicated to women entering their premenopausal, perimenopausal, and postmenopausal phases of life. Today we will discuss all things estrogen cream for the face. Next week, I'm going to take a deep dive and discuss the science behind what happens to our skin and beauty as we age. First, a quick disclaimer. Dermatology is my area of expertise. This is not medical advice, as you should always consult with your provider. So what is estrogen cream? Estrogen cream is a topical hormone that can be used on the skin for possible anti-aging effects. It's a cream that you can get from your doctor for treatment of other symptoms associated with perimenopause and postmenopause. Estrogen cream versus oral estrogen. The use of oral versus topical hormone replacement therapy has been an ongoing debate within the medical community, and that's simply because we don't really know. There hasn't been enough well-powered studies and statistically significant studies to guide providers with the information that we provide for our patients. The difference between oral estrogen supplementation and topical is actually oral supplementation is in the form of a pill that you ingest and take every day, whether that's the birth control pill or over the age of 52, usually hormone replacement therapy, which is a similar estrogen or a combination of different hormones as well. Topical estrogen replacement is simply that. It's a cream that gets placed on the skin that can have minimal to moderate systemic absorption, depending on the formulation and percentage of estrogen in the topical cream. Some of the potential benefits of estrogen creams topically on the face include collagen synthesis, which diminishes the appearance of fine lines and wrinkles, increase in elastin synthesis, thickening of the dermis and the epidermis, strengthening of the barrier, increasing in glycosaminoglycans and hyaluronic acid, as well as other multiple benefits in the skin. Again, these are potential benefits. Potential risks can include redness, possible acne, possible hyperpigmentation, or systemic absorption, which means some of the hormone gets absorbed through the skin and gets into the body. With that, there's a host of different potential risks that could go wrong, which is why it's important to follow up with your provider. Does estrogen cream boost collagen? Estrogen cream has been shown to increase collagen synthesis and elastin synthesis, which helps smooth fine lines and wrinkles and improves texture in aged skin. Now, why would you want to boost collagen? The reason why it's so important to boost collagen is estrogen depletion has a dramatic impact and slows down the collagen synthesis pathways in the skin. We're going to discuss this in more detail in next week's video. And the reason why I'm a little hesitant to recommend it is because I spent decades looking at skin cells under the microscope, and I've seen firsthand what estrogen and hormones can have on the histologic effects of the skin. So what is estrogen's effect on collagen, specifically on the face? Estrogen depletion can cause a loss of collagen, which creates sagging, increased texture, and fine lines and wrinkles on the face. So increasing our collagen stores will help reverse those changes. Again, we're going to talk about that in more detail in next week's video. Today, we're going to talk about the specifics of estrogen cream on the face. Does estrogen cream reverse skin thinning? Topical estrogen in the skin can increase collagen, increase elastin, restore the barrier to help minimize transepidermal water loss and help with dryness. It also can increase vascularity of the skin, which provides more nutrients to the skin cells, removal of toxins, and increased lymphatic drainage in the skin. It also helps increase hyaluronic acid, decreases collagenase enzymes, and increases glycosaminoglycans as well. So that was science, which is my first language. But in English, what that means is it just provides smooth, beautiful, healthy, vibrant skin. Science is my first language. I'm much better speaking science than English. So it sounds like a miracle cream, right? So why wouldn't everyone use it? Let's talk about the safety of it. Is estrogen cream safe to use on the face? Does it get systemically absorbed in the bloodstream, and can it have a potential for malignancy? And this is the controversy in the medical community, and this is why it's so important to follow up with your provider. And we don't have enough data to say if it's risky or not for potential malignant potential, cardiovascular effects, increased coagulation and coagulopathies, and some of the other deleterious effects that topical estrogens may have if it is systemically absorbed. If you have a family history of breast cancer, endometrial cancer, cervical cancer, or ovarian cancer, you may be at higher risk, and as always, it's important to follow up with your provider for this risk assessment. Although that there's a lot of anecdotal data pointing to the effects of topical estrogens in the skin, all the effects that we had mentioned before, increased collagen synthesis, elastin synthesis, all the amazing effects that it can have on the skin. Because we don't know about the potential risk, it's really difficult as a provider to say whether or not topical estrogen or oral estrogen hormone replacement would be best for you. So the typical cost of an estrogen cream is usually anywhere between $50 and $150. However, if you wanted to have collagen boosting actives without the risk that topical estrogen creams can carry, then sometimes you can look for some things in a drugstore that also may increase collagen stores, like a Depletion or a retinol. Or if you wanted to get a prescription from your dermatologist, tretinoin has immense data supporting its effects in the skin without the risk that topical estrogen may carry. So we talked about what we can get at a drugstore, we've talked about prescription tretinoin, and we can also talk about medical grade retinol. So my MDAiRE skincare line has the RxR retinol. I love it and I use it every day, but you can get a medical grade retinol from other skincare lines as well. This is ours, this is the one I use, the RxR retinol by MDAiRE. And if you want to be entered to win one of these, be sure to subscribe to my channel because we do give away each and every month. If you're going to use estrogen cream, these are some of the things to look out for. Make sure you don't have any irritation, which would present redness or itchiness or irritation from the site that you put it on your face. Other things that can happen is that you could sometimes have a hormonal acne breakout, because although estrogen doesn't cause acne, sometimes it can convert it into androgens or testosterone that can actually flare acne. Another thing is that although we know that the hormone fluctuations during pregnancy and postpartum can cause hyperpigmentation in some individuals, that's why during pregnancy there is darkening of the nipples, there could be linear nigra, there could be accentuation of new moles that get darker. We know that estrogens have a potent effect on the melanocytes, which are the pigment producing cells in the skin. But I don't know for sure as a physician if topical estrogens can increase melanogenesis or hyperpigmentation when used topically. However, spending decades looking at the skin under the microscope, when we would do skin biopsies and look at pregnant patients and patients who are not pregnant, there was a difference in the histological presentation of the melanocytes. The melanocytes would be big and they would be accentuated and they would be activated and more upregulated with their function when compared to the same patient's skin biopsy when they were not pregnant. So we do know that estrogens can cause activation of melanocytes. I don't know with the topical cream application, however, if that would increase hyperpigmentation or accentuation of melasma, just simply because there hasn't been any non-heterogeneous studies that have been done that are statistically significant investigating this. So it's important for you guys to remember also that there's a lot of clickbait education in the online world now, and just because something is new or trending or getting a lot of hype on TikTok or social media doesn't necessarily mean that it may be effective or may be better than what is already existing in our world to do things like stimulate collagen or to advance skincare. So for example, tretinoin has immense data behind its use and how effective it is in increasing collagen in the skin to help smooth fine lines and wrinkles and texture. But now that estrogen cream is getting a lot of hype and is just as difficult to get from your provider, you still have to go see your doctor, you still have to get a prescription, and there are risks that come with it. You know, instead of hopping on the estrogen cream bandwagon, when we already know that tretinoin exists with a lot of data supporting its use and its effects in the skin with collagen stimulation and rejuvenation, sometimes it's better just to stick with what we already know. But I understand it's important to address these certain trends that are going online, and I do think that there should be some benefit to an estrogen cream used topically. However, there's many other things that you have to take into consideration. The human body is very complicated, it's very dynamic, and it's not just as simple as, well, I'm having estrogen leaving my body in menopause, so I'm just going to put it on with a cream. The endogenous forms of hormones that are circulating through your blood and targeting all organ systems is a lot more powerful in the skin than a cream that may just be sitting on the skin and not even penetrating through the epidermis into the dermis where the fibroblasts are that produce collagen. So it's not just as simple as, well, I'm putting this vaginal cream on my vagina because I'm menopausal, and maybe if I'm losing collagen in my face and I put it on my face, it's going to work the same way. Even the topical vaginal creams that are used for hormone replacement therapy and postmenopausal women, there's different receptors on that skin surface. The mucosal surface has much more absorption availability than skin on the face that has a barrier and a stratum corneum layer, which prevents absorption. That's why most skincare products need vehicle delivery systems that are liposomal and microencapsulated, and vehicle delivery systems that allow those active ingredients to get past the epidermis, which is our barrier that protects our skin from the outside world, into the dermis where it can have effect. So what I'm saying is that if you're putting a topical estrogen cream on your vaginal mucosal surface, not only are there much more estrogen receptors there, but that mucosal surface is much more adapted to absorbing estrogen than your skin on your face. You don't have as many estrogen receptors on the skin on your face, and even if you put the estrogen cream on your face, it may not be passing through the epidermis unless it has vehicle delivery systems that a lot of skincare products have. But since most of the topical estrogen creams that are being used in today's world are formulated and prescribed for vaginal mucosa absorption, it's just not the same type of absorption, and it's a different skin type that may have a different response than just simply putting on your vaginal mucosa and putting it on your face. It doesn't work that way. Again, the body's highly complex, and the skin is a very dynamic, highly complex organ system. It's like having a lock and a key, and I always explain this to the medical students and the residents when I'm teaching. When you have a receptor, that's like having a lock, and you have a key, which is a ligand, which can be either a hormone like estrogen, it could be vitamin A, it could be vitamin C, and you need that lock and key to work to open the door that stimulates a downstream, what we call signal transduction cascade. In science, that means a key opened a door and now this pathway is going. For example, with tretinoin or vitamin A or estrogen for that example, if you're going to open the door to a fibroblast that synthesizes collagen, you'll have collagen synthesis downstream in the pathway. But if you don't have that lock and key that are matching, it's not going to open the door. Your mucosal surface on your vaginal wall has a lot of estrogen receptors. There's a lot of doors there. And if the estrogen cream is the key, it's going to open a lot of doors and stimulate those results. But the skin on the face may not have the right lock. And so if estrogen is the key, it's not able to open any of those doors and have a downstream effect in the skin. I've seen a lot of people on social media referring to estrogen depletion syndrome or the post-menopausal period as EDS. And just so you guys know, most board certified dermatologists, when we say EDS, that really is referring to an actual genodermatoses called Ehlers-Danlos syndrome. And there is multiple types of Ehlers-Danlos syndrome, and it's a collagen deficiency. So there may be some confusion if you guys are asking dermatologists or asking online to different providers. EDS can be confusing. So I know that a lot of people are referring to estrogen depletion skin as EDS, but it also can mean Ehlers-Danlos syndrome. After being in practice for over 15 years, I've seen actual patients go through menopause, and I've seen the effects that it has had on their skin. And it's very upsetting, but estrogen depletion and going through menopause absolutely wreaks havoc on your skin. It not only affects your skin and diminishes your collagen and your elastin, which we'll get into next week's video, it causes fat pad atrophy, laxity. It just really wreaks havoc on the skin. And I've seen patients in the premenopausal, perimenopausal, and postmenopausal areas and phases of their life, and I've seen in front of my own eyes the changes that they undergo. So we have non-surgical options in our office like lasers and resurfacing and biostimulatory injectables to help get them through that period. But there is no doubt, and I'm astonished when I see it, the effects that menopause and postmenopausal phases have on the skin, and I see it in my own patients. Now, I myself have not gone through menopause, and I understand I'm going to be going through this myself, and that will be my own journey that I go through. And I understand that I have not yet gone through this, but I am very empathetic of my patients who are going through this period, and it could be a very difficult time. I actually do not take any hormone replacement therapy because I am not going through menopause and I'm not feeling the effects of perimenopause. However, I have been on estrogen as a birth control pill since I was 18 years old, and I'm now 46, and it probably has had a beneficial effect in my skin. Now, this is a lot to unpack in one video, so that is why I'm dedicating a lot of this content to next week's video. Seeing patients in the perimenopausal and menopausal periods and the things that we can do in the office to help them and assist them, and the potential role for estrogen creams will be something that we'll discuss in my next video, because there's just too much to squeeze into one video today, so be sure not to miss that. Can estrogen creams be used with other products like tretinoin or vitamin C or glycolic acid and so forth? I think it's really important, if you are going to implement a estrogen cream into your skincare regimen, that maybe you do it at a separate time than you're doing your skincare regimen. So say you put on your skincare products in the morning and at night, maybe wait a few minutes or even 30 minutes until all of your products have been absorbed, because a vaginal topical estrogen cream can limit or prevent passing through of your active ingredients into the deeper layers of the skin. So I don't recommend using it in conjunction with your other actives unless you space it out in an amount of time where your other active products have had a chance to penetrate the deeper layers of the skin. In addition, certain active ingredients like L-ascorbic acid and vitamin C needs a certain extracellular milieu, or it needs a certain environment, a certain pH to be readily absorbed. And if you have an estrogen cream being used at the same time as application of the L-ascorbic acid, it may affect the pH and the absorption of an active ingredient like vitamin C. Does estrogen on the face worsen melasma or cause excess hyperpigmentation? And anecdotal evidence say that it could possibly correlate with hyperpigmentation. And we know from spending time looking under the microscope at people who have hormone fluctuations during pregnancy, for example, their melanocytes, which are the pigment producing cells, are all revved up and making extra melanin. That's why you get melasma during pregnancy. That's why you get melasma when you're on the pill or the IUD that is secreting hormones. We know that hormones, increase the melanocytes, which are the pigment producing cells, to make more melanin, which can hyperpigment the skin, causing melasma, chloasma, accentuation of solar lentigines and brown spots. The anecdotal data is equivocal, and there has not been any, long-term statistically significant, well-powered studies to investigate this, so it's simply unknown, but I would proceed with caution with use of an estrogen cream if you suffer from hyperpigmentation or melasma. In-office procedures that would be similar to using an estrogen cream could include anything that is going to be biostimulatory or stimulate collagen synthesis. Thermage is one of my favorite biostimulatory collagen banking procedures, and absolutely this would increase collagen stores to help replete or reverse collagen loss due to EDS. In addition, lasers, ablative and non-ablative lasers, can also help increase collagen stores and help reverse the skin effects that show with EDS. So laser resurfacing can be non-ablative and be more superficial and lighter, like a Clear and Brilliant or Clear and Brilliant Permea, or it could be a hybrid of ablative and non-ablative like the Halo laser. It could be non-ablative and very effective like the Fraxel Restore, also known as Fraxel Dual, or you could go to ablative laser resurfacing like an Erbium or a CO2. All of these lasers are going to stimulate collagen synthesis to help resurface the skin, help smooth fine lines and wrinkles, and improve texture, and increase cellular renewal, which will give beautiful results. But they all vary on the spectrum with their intensity and their level of aggression, how deep they go into the skin, and usually the stronger lasers, which have more impactful results, also come with a little bit more discomfort and downtime. One treatment that I definitely would not recommend is microneedling. A lot of you guys have asked me about microneedling, and I get questions on microneedling all the time, and that is one treatment that I would not recommend, and I will discuss this in a later video. So just looking at different price points, prices are always going to vary, but when you're trying to decide whether to invest in an estrogen cream or a laser procedure that's also going to stimulate collagen, these are the kinds of things you want to think about. Going to see your provider and spending anywhere from $50 to $150 on an estrogen cream, which may last 1, 2, or maybe 3 months, depending on the amount that's given in a tube or a bottle. You have to price point that out and see how that would compare to doing an in-office laser procedure. Now, in-office laser procedures can vary in price depending on the provider in which you go to. Some providers have payment plans. Some providers also will sell packages, which I actually don't recommend, because I feel that a lot of patients who see providers with packages, they don't even really see the results after one treatment, but they're roped in and have already paid for a second and third, and it's just a waste of money. But I feel that if you go to a provider who has payment plans or a package, this may be cost effective for you. And I always say it's really important to look into your provider and their level of skill, their level of training, their before and afters, and making sure that they're well versed in the devices that they're using in their office. If you need more information in this regard, I have another video which you can refer to where I talk about how to find a qualified provider. Also, when trying to compare an estrogen cream and the results from that with an in-office procedure like a laser like a CO2 laser can last 1, 2, or up to even 5 years with respect to the results, where an estrogen cream is going to give you results while you're actually using the cream, but once you stop using it, your skin will default and go back to the way it was before. So that's also something to consider when talking about price and duration of the difference between these two collagen boosting procedures and treatments. So do I use it? And the answer is no. I don't use estrogen cream anywhere, but I am on the estrogen birth control pill, and I have been my entire life, with the exception of my 2 pregnancies, but I'll talk about that next week. So I am in the aesthetics field, so I do have access to all of these in-office procedures, lasers, devices, collagen stimulating procedures, but I understand that this may not be an option for everyone. So if I didn't have access to lasers and in-office procedures, what would I do to stimulate collagen in my skin? Would I use an estrogen cream? Honestly, probably not, just because there hasn't been enough data and clinical trials and research demonstrating the safety and efficacy of topical estrogen creams on the face, but I would use more medical grade skincare products or even over-the-counter drugstore products that would also stimulate collagen. At different price points for different people, if drugstore options are your only option, then using a good sunscreen every day can be very powerful and important, and using a good collagen stimulating vitamin A derivative like adapalene, for example, or an over-the-counter retinol would be beneficial. If I had a little bit more wiggle room, I would invest in at least one medical grade skincare product, not several, but just at least one that would address my own skin concerns. If I had melasma, I'd invest in a very advanced vitamin C with technology and vehicle delivery systems that would maximize the efficiency of that topical cream that I'm using at home. If I had sun damage or wanting to reverse rhytids or wrinkles or fine lines, I would invest in a medical grade retinol or vitamin A derivative, or I would get a tretinoin prescription from my provider. It just depends on your own skin ailment, what you want to invest in. And so for those of you on a budget, if you want to go drugstore and at least use sunscreen, that will be very beneficial. But if you want to go medical grade, not even getting all the medical grade skincare products in a whole regimen, but maybe focusing on that one key product that's going to be targeted most for the problem that your skin suffers from the most, would be my best recommendation. So today's video is more focused on estrogen creams, but next week we'll dive into the science behind what happens not only in the skin during menopause and post-menopausal time periods, but the structural features of the face and overall beauty and how that changes during this time period. And we'll talk about different budgets and different options on how to help reverse these changes or address them as they're happening.